With COVID-19 cases increasing in Saline County and the region, I'm here today to talk about Salina Regional's preparedness. I'm Dr. Rob Freelove, Chief Medical Officer, Salina Regional Health Center.
Dr. Freelove, thank you so much for being on the show. I wanted to have you on to give us a COVID-19 update.
Yeah, we kind of had a surge there after things kind of opened back up. Our cases went up rather dramatically. That slowed back down a little bit. We're back down to here. We've seen kind of single-digit new cases each day for a little while now. So that's much better than when we were getting 15, 20, 25 a day. We have had some hospitalizations during that time. We've been anywhere from maybe 2 to as many as 9 people in the hospital. Very far from overwhelmed, but we are seeing some hospitalizations there. And not all of them are from Saline County. We're actually seeing some patients we're hospitalizing who are coming in from out in the region in our referral area. So we're seeing some patients coming in from some other counties. So I tend to focus primarily on Saline County when I'm looking at the numbers, but then when I'm looking at hospitalizations, I do pay attention to those other counties, and we are seeing some increase there.
Why don't you talk about the preparedness for the hospital?
We were very fortunate early on. We didn't see a big surge in cases and certainly didn't see a lot of hospitalizations. That gave us some time to really prepare and plan, and so we took advantage of that time. We've put in plans for our first 10 patients and then our next 10, and on and on and on, up to what our capacity could possibly be even. And we've tried to increase the capacity for providing care for patients with COVID. We've added negative pressure rooms. That's where all of the air is being essentially sucked out of the room, and it's constantly being moved through that way so that stuff doesn't go out into the hallways, and then anything that's airborne is actually removed from the room. And we've probably doubled our capacity at least in negative pressure rooms, both in the intensive care unit and then also out on the floors for those patients who maybe aren't on a ventilator, aren't critically ill, but are sick enough that they need to be hospitalized. So, we've done as much as we can to build as much capacity as we can so we can continue to serve Salina and the region for COVID as well as everything else. We've done it in a way that we've tried to segregate that care so that our COVID patients are being taken care of in a specific part of the hospital that's a little bit away from where other patients are being taken care of. We really focused a lot on adding capacity to provide care for patients with COVID, and then doing it in a way that we can run parallel. We can take care of patients with COVID safely. We can take care of our other patients safely.
Thank you so much for being on the show, and great information. And thank you for watching. For more information, visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.